Hello everyone, today's video is another Q&A video talking today about MSM, high dose sulfur therapy, and some side effects, questions around that. Question about breathing issues related to mold exposure, and oh my goodness, what's the last one here? And then persisting yeast overgrowth issue. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you wouldn't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question is, I have breathing issues from mold-induced asthma. What supplement would you recommend to lower inflammation in the lungs, as well as one that thins mucus? I do have inhalers. So thanks for the question. I obviously can't give any direct advice over social media for this, but just speaking about it academically in terms of what I use with my patients for similar issues or with similar questions. So there are certain supplements that have mucolytic effects. N-acetylcysteine is one of the most common ones, or NAC, a very common one that's used. Sometimes folks will use proteolytic enzymes like stratopeptidase or nattokinase or bromelain in between meals or away from food to help thin mucus secretions, and that they can help to reduce inflammation as well. When it comes to treating the lungs, it really depends on kind of the severity of the symptoms, kind of the cause of what's going on. One other treatment that can be beneficial is using a nebulizer, so nebulizing essential oils or other substances that can help to reduce inflammation directly in the lungs in some cases. Also, they oftentimes will, or depending on the substance in question, essential oils being case in point here, good at killing infection in the lungs as well, or fighting off infection in the lungs and sinuses. So those are some of the common agents that I work with. If there's a mold allergy, then using a treatment to directly address the allergy can be very helpful. So low-dose immunotherapy or low-dose allergen therapy for treating mold allergy or addressing mold allergy can be very helpful in a lot of cases. In my experience, it's not curative for every case, but it's in a vast majority of cases helpful, if not very helpful. So those would be the main things that I would be thinking of on that topic. Any kind of further questions on that, just post in the comment section below, and I'm happy to flesh that out more if that's of interest. There were a couple of questions related to MSM. So the one question was, are loose stools common when starting MSM? MSM being methylsulfonylmethane, and that being the agent that we use to address or to work with a high-dose sulfur protocol if we're trying to address or work on joint issues, chronic inflammation issues, chronic digestive issues, helping to support the connective tissues in the body in general, etc. Lots of different applications there. I interviewed really brilliant naturopathic doctor from Washington State named Kathleen Janelle, and Dr. Janelle was on my podcast, the Overcoming Chronic Illness podcast. So if you're interested in learning more about that, please cross-reference that episode or look her up on her website, which is gijanelle.com. So with MSM therapy, it is or MSM supplementation, loose stools are a fairly, when you look at the list of side effects from MSM, loose stool would be the main side effect on that list. With that being said, I have found that to be a very, very infrequent side effect of taking MSM, even at very high dosages. Like, the standard like high dose MSM is like 30 times the typical amount of MSM that most people would take. So standard dose of MSM is like 1 or 2 grams a day. High dose MSM is like 30 grams a day. So it's a very, very high dose. With the high-dose MSM, very rare to see loose stools. What's been interesting, I think clinically interesting, in my opinion at least, is that a number of my patients have, not many, but I've had several, I don't know, maybe 30-ish patients or so who have had loose stool as they're building up their dose of MSM, but once they back off on their dose, let things settle out, and then start to increase again, the vast majority of those patients have then no longer had loose stool. It's almost like it was like a detox or some acclimatization or maybe a microbial die-off thing that was happening in the gut, because MSM sulfur has an antimicrobial property to it. And so in those cases, the loose stool wasn't really a true side effect. In my opinion, it was more of a physiological reaction to what the MSM/sulfur was doing in their body. I have had a handful of those patients though where they can only take up to a certain dose and then it causes loose stool or bothers their stomach in some way, shape, or form, and so they've only been able to tolerate a lower than they've not been able to get up to the full 30 grams, but that's been relatively rare. So can happen, but pretty uncommon side effect, and maybe just more of a functional issue that's coming from that. The other question that was related to MSM is that I posted another video about it a little while ago, and I must have said something in the video to the effect of, you can't be allergic to sulfur. I think someone was asking if I'm allergic to sulfa drugs, does that mean I can't take MSM? And I would have said something like, you can't actually be allergic to sulfur. You can be allergic to sulfa drugs, which are antibiotics that have a sulfur component to them. But when one is allergic to a sulfa drug, they're allergic to the maybe the whole molecule or certain components of that whole drug itself. It's not the sulfur specifically that they're allergic to. So then the question here in the comment section was, can't be allergic to sulfur, then what causes the hay fever reaction to things like red wine and sulfa drugs, etc. So I mentioned the sulfa drug thing, but in terms of like red wine or things that have sulfites in them, like dried fruits and things like that, folks can absolutely have allergic type reactions to those, or really it's more of like a sulfite intolerance reaction, which is splitting hairs a little bit, I suppose, but to my understanding that's not an allergy, it's more that it's more of an intolerance, if you will. So that is specifically to sulfites. So when sulfur is metabolized in the body, it goes through the sulfation pathways, and they're converted into sulfites as part of that process. So some folks, when they consume things that are high in sulfur, they can absolutely react to that, not because they're allergic to sulfur, but because they are reacting to the sulfites that are being produced. As far as the ability of MSM to contribute to sulfite formation in the body, yes, that's something that can happen, to my knowledge, but I really haven't seen that happen. But sulfite intolerance or reactivity, it's a relatively uncommon thing, and I just haven't had any patients who have a known sulfite intolerance and then they've tried MSM, so I don't know exactly how that all plays out, but I would use a lot of caution in my practice. If I had a patient with a known sulfite intolerance, I'd probably try other things besides MSM before working with that, but I'm not really sure how that plays out, to be honest. But yeah, so kind of like, seems like it's splitting hairs a bit, but like, sulfur is a thing, sulfites are a thing, sulfates are a thing, and then sulfa drugs are a totally different thing, so it's kind of talking about different topics. Last question here is, the person said, I just finished 4 weeks of antibiotics and had yeast growth even with the use of boric acid. Does that mean I'm probably always harboring yeast, or is 4 weeks so long there is little way around it? So I was a little bit unclear on the exact details of this question, just due to some of the language that was used. So I'll take my best crack at it, but if I'm missing the mark here, just post in the comment section below, and I will do my best to answer it soon and address whatever you're asking. So the fact that there's mention of boric acid would suggest that this is probably a question about vaginal yeast, because boric acid suppositories are used for vaginal candidiasis, so I'm assuming that's what we're talking about here, or that's what the question's about, but if I'm wrong, again, just correct me in the comment section. Kind of the question around, developing yeast, like presumably a yeast infection despite using boric acid suppositories while taking antibiotics. It's something that I have seen that in some of my patients before, and boric acid is good. Boric acid, to my understanding and my experience, is more often used for bacterial vaginosis. So I don't personally kind of mentally classify boric acid as being the best thing or the most kind of potent thing to fight back against yeast in the vaginal canal. So it may be, if I was to see a patient like this in my practice, I'd be thinking like, well, maybe the boric acid just wasn't strong enough. There's also just some cases where folks are just really, really sensitive to anything that disrupts their probiotic levels, and so even using something that I would consider to be stronger, like say ozonated oil suppositories, so I find those to be really one of the best things to use, if not the best thing to use against vaginal yeast, or using like a pharmaceutical option instead. Sometimes even using like the best of the best stuff, there's still a yeast infection that ensues. I don't know that type of response definitely suggests that there's like this, chronic yeast overgrowth picture going on. My understanding is that yeast is a normal part of the vaginal microbiome. But in relatively small amounts. So I suppose that there's always going to be some harboring of yeast. It's just a question if there's a harboring like an excessive amount of yeast. If I were to see a patient like this in my practice, I would be thinking that maybe there's some more work that we want to do in terms of bolstering the health and integrity of the vaginal microbiome, probably using a stronger anti-yeast agent than boric acid if future antibiotics were needed, and then also looking at the whole patient picture to see like are there other symptoms or features of their case that would suggest that maybe there's a yeast overgrowth propensity in the intestinal tract or other areas that would suggest that maybe the overall yeast levels in the body need to be taken down a few notches. So again, if I didn't hit the mark on the answering the question directly, just let me know what I missed there, and I'll happily post another video about it soon. I will leave it there for now. Any questions or comments in general, just post in the comment section below, and I will do my best to answer as soon as I can.